really diving into the deep end today, huh? This research on acute exacerbation of interstitial lung disease, woof, that's a mouthful.
It is.
But, it's serious stuff, and we're going to break it all down, figure out just what this medical mystery really is.
Okay.
We're looking at a 2023 article from the World Journal of Critical Care Medicine for this one, and let me tell you, it's a wild ride.
Yeah.
First things first, we got to clear up that we're not talking about one single disease. Interstitial lung disease, or ILD.
Yeah.
It's more like an umbrella term, covers over 200 different disorders.
200.
Yeah, makes it tricky to diagnose and treat.
Absolutely.
And get this, they updated how they even classify these disorders back in 2013. Shows you how much we're still learning.
Yeah, it's a constantly evolving field for sure. ILD, it's not just one thing. It's like this whole, imagine 200 pieces, right? All part of this puzzle.
200 pieces, wow.
And when even one of those pieces acts up, that's when you get what we call an acute exacerbation. And here's the thing, because these diseases affect the actual core of your lungs where your blood swaps oxygen, any exacerbation is really dangerous.
That's where it gets serious. Okay, so that leads us to the big question.
Yeah.
What exactly is an acute exacerbation? It sounds pretty intense just from the name, but what makes it different from, ILD just kind of getting worse over time?
You're hitting on a really crucial point. It's not a gradual thing. Think of it almost like falling off a cliff.
Yeah.
A sudden steep drop.
Oh, wow.
That's what makes acute exacerbation of ILD, or AEILD as it's often called, so dangerous.
Makes sense.
It's really a whole other ballgame. In fact, back in 2016, doctors actually got together and came up with very specific criteria, a definition, to be sure they were all on the same page about it. Because they can't be mistaking it for something else.
Like a detective realizing they've been on the wrong trail this whole time. And speaking of clues, this research paper, it actually has this whole table, like a list of usual suspects when it comes to breathing problems.
Yeah.
Pulmonary edema, pneumonia, even like if someone inhaled something they shouldn't have. Doctors have to go through and rule all these things out before they even land on AEILD.
Absolutely. It's a process of elimination. And that's where the real detective work starts. Because these patients, their lungs are already compromised.
Right.
So even what might seem like a common cold for you or me, it could be the thing that, throws everything off balance and triggers a full-blown AEILD episode.
So it's not even necessarily that something new is happening, it's that their system's already so vulnerable.
Exactly.
Which, this paper lists some wild potential triggers for an AE, and we're not just talking about, catching a cold. It says stuff like having a bronchoscopy, having surgery, even air pollution.
Right. It really makes you think about
That's a lot.
It highlights just how vulnerable these patients really are.
For sure. And, what gets me is we've got this disease, ILD, which is already a bit of a mystery, right? And then on top of that, these sudden health plunges that are somehow even more mysterious.
It's true. Honestly, that's one of the hardest parts for patients and families, I think. All this uncertainty.
Totally. Makes it hard to know what to expect, how to plan.
Absolutely. And that's why it's so crucial, communication.
Yeah.
Doctors, patients, families, everyone being on the same page. Because even if we don't have all the answers, we can still work through it together.
Absolutely. So speaking of figuring things out, let's talk diagnosis. This research really zeroes in on chest CT scans. They even talk about seeing these different ILD patterns using terms like UIP and NSIP.
Right.
Are those the telltale signs, like the fingerprints of ILD that help doctors know what they're dealing with?
It's a great way to think about it. Those patterns offer crucial clues. Think of UIP as, imagine, scarring.
Yeah.
But in a pattern that makes the lungs look almost like a honeycomb on a CT scan.
A honeycomb.
Yeah, it's pretty distinct. And it indicates a very specific type of damage. Now, NSIP, that one might show up as more like hazy patches. Doctors call them ground glass opacities.
Ground glass. Never heard that one before.
It's very visual.
Right.
And it suggests a different kind of involvement in the lung.
So by spotting these patterns, doctors can get a better idea of which specific ILD a patient might have, and from there, start to figure out the best way to treat it.
Exactly. But like any good mystery, there's always a twist.
Oh, what's the catch?
As valuable as those CT scans are, they don't tell the whole story.
Right, I bet.
Doctors have to take everything into account. Patients' medical history, their current symptoms, even their lifestyle, it all plays a role in getting that complete picture.
So it sounds like even with all that, even nailing down a diagnosis, we're only just getting started. What about treatment? What can doctors actually do for someone who's in the middle of one of these sudden downturns, these exacerbations?
Well, the absolute first thing, always is supportive care,
Mm.
especially when someone's having trouble breathing.
Makes sense.
So that means oxygen therapy, and sometimes, if it's really serious, even mechanical ventilation. It's all about giving the body what it needs to weather the storm.
Buy time for the lungs to recover. So, medications then. I'm seeing this paper talk about immunosuppressants, corticosteroids, things like that. But then it also says the evidence for those is limited. That's got to be tough for everyone involved.
It is a tough call, yeah.
Yeah.
Because on the one hand, you have this very sick patient, a life or death situation even,
Yeah.
and you want to try everything you can.
Of course.
And the thinking is corticosteroids, they can kind of tamp down the immune system's overreaction, which we think is part of what's going on in AEILD.
Yeah.
But do we have rock-solid proof it works every time? No. And they come with side effects, too.
It's almost like trying to solve one problem, but potentially creating another.
That's a good way to put it.
And
that's why that open communication is so important. The doctor has to lay it all out, the potential good and the bad, so the patient can make an informed choice about their own treatment.
Absolutely. Now, there was also mention of these antifibrotic medications.
Yeah.
Drugs with names like nintedanib and pirfenidone.
Right.
Those are used to slow down the scarring in the lungs with ILD, right? Any chance they could help with these sudden exacerbations, too?
That's the million-dollar question, and researchers are trying to figure that out right now. Those drugs haven't been studied specifically for AEILD yet, not in a major way.
Yeah.
But there's a lot of interest in seeing how they could work for other inflammatory lung conditions. So it's possible that down the line we'll have more weapons in the arsenal, so to speak.
I like the sound of that. More options are always good. This research also brought up something called HFNC, high-flow nasal cannula, which it's a way to deliver oxygen that might help avoid the need for a breathing machine altogether. Is that right?
That's the idea. And yet HFNC, it's definitely gaining traction, especially with how successful it was during the COVID-19 pandemic.
Right.
Now, the research specifically on HFNC for AEILD, it's still early days. We need more. But it does seem like it could be a really valuable option in some cases. Less invasive, easier on the patient.
Always a good thing. Wow, we have covered a lot today. This AEILD, it's a real puzzle, isn't it? Complex, high stakes.
It really is. But that's how it goes with these complex medical mysteries sometimes. The important thing is that we keep asking questions, keep digging for answers.
Exactly. And research like this, that's how we shed light on these conditions that most people have never even heard of. The more we know, the better equipped we are to help people.
Couldn't have said it better myself. And those conversations, like the one we're having right now, that's how we raise awareness.
For sure. And that's what this is all about, right? Giving people the information they need. So to everyone listening, thank you for joining us for this deep dive into AEILD. And remember, the learning doesn't stop here. Check out the research we talked about if you want to explore even more. Until next time, stay curious, everybody.